Welcome, my name is Peter Strong and I provide Skype therapy online for the treatment of anxiety and depression, for working with addictions and other common psychological, emotional problems that benefit from the techniques of mindfulness therapy, which is what I offer online. So Skype therapy is a very good choice if you are looking for an alternative to going to see a therapist in their office. If you can see each other, which of course you can when you use Skype or similar video platform, then the quality of psychotherapy will be just as good. You do not need to be in the same room to benefit from psychotherapy. You do need to see each other. So nowadays, Skype and similar internet video services allow you to see each other in real time, and the quality of these services has gotten much better over the years, and it's now almost like being in the same room with a therapist or other person that you are working with. So that's the main thing. Skype therapy allows you to see each other rather than using older forms of online therapy that might rely on email correspondence or some chat format or whatever. You do need to see each other. That's my opinion. People like the convenience of Skype therapy because it means that you can schedule it from home. You don't have to travel to the therapist's office. It's much more comfortable for most people. People feel more comfortable conducting their therapy sessions from home under their direction rather than going into a therapist's office. If you're living abroad, then clearly being able to speak to a psychotherapist via Skype is a necessity, because it may not be possible to find a therapist in your local area that will offer the kind of service that you want. So I do work with lots of people who live abroad, and also people living in rural areas or places where it's difficult to find the right kind of person to work with. So the style of psychotherapy that I have developed and that I teach online via Skype is called mindfulness therapy. This is a system that I developed some years ago, and which I also call mindfulness meditation therapy, which really works at helping you manage your emotions more effectively yourself. The purpose here of the Skype therapy sessions is to work with you and guide you in learning how to work with your emotions more effectively, so that you can help heal those emotions and break free from being controlled by emotional reactivity. So in the case of anxiety, we learn how to work with the anxiety and help it heal. That's very important. And the same goes for depression. Underneath anxiety and depression, you will always find core emotions that are essentially stuck and are unhealed. And our job is to develop a very conscious and caring relationship with these core emotions. And that's the primary mission in mindfulness therapy. It's about changing the way that you relate to your emotional suffering. We have to break free from those habits of blind identification and those habits of avoidance and aversion to unpleasant feelings. If you push your emotions away, they will not be able to heal. This is really important to understand. You have to fully embrace your anxiety or depression or other emotions in order to help them heal. The real problem that describes emotional suffering in general is that people do not have a conscious and caring relationship with their emotional suffering. They push it away. They avoid it. They seek distraction. Sometimes even using techniques like meditation as a way of trying to escape your pain. And that approach is the real problem here. So that's what we describe as reactivity. And meditation can be a form of reactivity, of avoidance. So when I teach mindfulness meditation, I teach meditation on the mind, not as an attempt to escape the mind, but rather to fully embrace the mind with this quality of compassionate, conscious awareness. This is what promotes healing. So avoidance and aversion and other forms of reactivity simply increase the suffering. It prevents healing and often makes them a lot worse. The same goes for medications too. Medications, from my teaching, are not really very useful because they are another form of avoidance. They are taking you away from your emotions, and that's why medications do not heal anxiety or depression. They may reduce symptoms, but they do not heal the underlying cause, because the underlying cause of anxiety or depression or addiction is psychological in nature, and that requires a psychological intervention. You have to learn how to work with those underlying reactive habits that cause your emotional suffering. So in mindfulness therapy and mindfulness meditation therapy, we are really developing a very strong conscious awareness to investigate how we create anxiety and depression. What happens in the mind that creates these forms of emotional suffering? We look very closely at the core emotions and we respond to them with compassion to try and help them heal by developing a conscious, present, compassionate relationship with those parts of ourselves that are in pain. We also investigate the quality of reactivity that's supporting that emotional pain, such as cognitive reactivity, reactive thinking, rumination, incessant worry-based thoughts and thinking. When we become blindly identified with reactive thinking, that has the effect of feeding the anxiety or depression. It stops them healing. So we want to see the reactive habitual thinking very clearly. We want to see how that works. And the general rule here is that the more you see of these blind reactive habits, the freer you become. Choice is a function of freedom, and freedom is a function of consciousness. The more aware you become, the freer you become. It becomes possible for your own intuitive wisdom to go to work on those habits and start to change those habits quite naturally. So this is a very important theme. To the very action of developing mindfulness towards your anxiety or depression through meditation on your anxiety or depression facilitates healing in a very profound way. So I will teach you during our Skype therapy sessions together exactly how to do this, how to apply mindfulness and mindfulness meditation to promote healing. This approach works extremely well. It really does. And it's not surprising, really, because what you're really doing is paying attention to your habitual patterns that cause your suffering instead of avoiding them. And like anything else in life, if you really focus conscious awareness on anything, it will get better, it will improve as a result of that increased conscious awareness. So this is a really important principle. In my book, The Path of Mindfulness Meditation, I refer to this as the liberating effect of mindfulness. The more you see mindfully, the freer you become. Also, developing the quality of compassion is very, very important. So mindfulness is not just awareness. It's the combination of awareness and compassion. These two work together to promote healing and well-being. Because the other side of mindfulness is developing well-being and happiness. The first stage in that movement towards well-being and happiness is to overcome suffering. So we focus on suffering simply because that is an indication of where the mind has become stuck in these reactive habitual patterns. So the first job is to unstick those places where we are stuck. And then we start to develop more and more natural joy and happiness through increased access to experience through mindfulness. So if you'd like to learn more about Skype therapy and if you're interested in online Skype therapy sessions with me, then do please go to my website and go to the contact page and tell me more about yourself and what you've tried already and what you're struggling with, and I'll be happy to answer any questions you have. When you feel ready, we can schedule a Skype therapy session, and you'll see changes even after that very first session. I'll be teaching you methods that you can apply yourself based on mindfulness that will help you work with your anxiety or depression or addiction or emotional trauma as well. Whatever the form of your emotional suffering, it will most definitely benefit from mindfulness training. So please contact me if you're interested in Skype therapy and mindfulness therapy in general. Thank you.